Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental practice brokerage for 15 years, and enjoying every day. Today's topic is great opportunity in affluent Queens County dental office, grossing over $1 million. We'll get into this particular practice, and that's what this is about today. As you know, we have 10 employees now. We're in 25 states and growing. We're available to you 363 days a year. We take our Christmas and Easter. You can reach us at 201-663-0935. And the website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So call us anytime, even if you just want to chat. There's no charge to chat. If you want an evaluation, we'll try to give you a short one. Just give us a ring. Be happy to talk to you. Now, and all the information you're about to hear today is for entertainment purpose. If some of you are thinking about selling to a DSO, call us. We work with them all the time. We're independent of them, but they will often pay our legal fees. But the more important thing is we know most of them out there. I think we work with 142 of them around the country, and we believe we know who's who and who's the best and who we have experience with and who will go to closing, who's having trouble maintaining staff, who's not growing anymore. We think we can be that go-between, and they'll often pay our commission, so we no commission to you generally. That's for the larger practices, grossing over $1.5 million ops, hopefully, and you're willing to stay on. Of course, as always, you don't get all your money down payments at once. They'll hold money back, and the release of money is based on performance in the practice often. But call us. We'll talk to you about it and tell you what we have, and we can go on from there. But if the practice grosses over $1 million, any seller, based on some minor criteria, will usually reimburse your legal fees upon successful closing. I'm not aware of any broker in the country that does that. And we've done that. Did it 2 weeks ago, and then before that, 2.5, 3 weeks ago. So we've done it quite a bit. Now, let's go over this practice today. It's a great area. This is an affluent area of Queens County, New York. Very popular area. Housing there is expensive. Homes are expensive, but it's a sought-after area, subway stops and so forth, close to Manhattan and Queens County. This is a popular one. Now, this practice in particular is grossing over $1.5 million. I've been there, seen the practice, beautiful inside. Doctor owns the building too, and probably set up a rental for you, maybe a purchase in the future, but right now just a rental. The office is open at this point 6 days a week. And doctor has some associates. The seller is probably going to retire, tired of doing dentistry, a long time, and wants to retire. However, the associates will stay, the staff will stay, and of course the staff don't know it's for sale. We keep that confidential. There's 3 opportunities now. I think you could squeeze another in. Doctor owns the building, so you have flexibility, possibly grow and get more operatories out of it. There's about 3 dentists working there now, some associates, some specialists to work in. There's 1 or 2 hygienists working, and then the rest is fully staffed. Some procedures get sent out, some of the molar gets sent out, some of the oral surgery gets sent out. As far as marketing and advertising, then they're really not doing any. So, somebody's not advertising and marketing could usually have a 10% increase in the practice. And this doctor's tired, as most doctors are, not doing much marketing or advertising at all. So you can grow with that. 10% growth with marketing and advertising, 10% growth with just energy, the extra energy you'll put into the place. So you could reliably, foreseeably, in my opinion, do 20% better just the first year. Now, this practice is about 50% fee for service, 50% PPO. There's no Medicaid or anything like that. And they're really not advertising or marketing. It's fully computerized with digital X-rays and digital computer also. at this time. So it's pretty much turnkey, beautiful office. I've been in there before. Since the doctor owns the building, it's ground level entry, and there's some rentals upstairs. You probably get $3,000, $3,200 a month from there, easy. It's over 1,000 square feet, and with many of the buildings in Queens, is a basement too that's available, storage or whatever. Property taxes on the building are reasonable, about $8,800. That's not too bad. And let's see what else we have. The owner utilizes the space about 100% of the time. So there's, it's not really subbed out to anybody. It's just the owner there and the owner associates. Crown fees are getting up to, on the private patients, getting up to $1,200, $1,198 per posterior crowns. Full mouth x-rays are at $81. That should be higher. So some of these fees you can increase right away. Great way to increase the practice, just increase the fees. And you don't have to worry about losing everybody right away. Not if you do it with, doesn't have to be always a prophy fee. It could be some other fees like crown fees and so forth. And then one service composite, I think they're doing about $142 on that. Now, the associates are paid based on what they produce and collect. They'll be getting a percentage of that. Okay, and there's two or three associates there because I think two of them are specialists and maybe one's a GP, or could be an extra GP too in there. The rest of the staff has very adequate salaries. Very fair indeed. And the doctor will stay on for a short period of time, but I think the people that would most likely stay on, I would say, is the associates. Because doctor wants to retire, but he will help you in a transition. As always, the staff doesn't know it's for sale. This practice will go for a fair market value. Give us a call. We'll send you, and hopefully you've already signed up for your with your non-disclosure agreement, so you're getting these practices every month. If not, call us and we'll get it for you. But this is Queens County, turnkey operation. You would do great there. We anticipate, our opinion, 20% growth the first year. Since they're not marketing, advertising, should get 10% if you're advertising growth there. And maybe some extra hours put in and better treatment plan follow-up. A lot of senior doctors don't hustle when it comes to treatment plans. They don't follow up. They're a little tired. They've been doing this a long time. They'll present a treatment plan, but don't necessarily, run all over town chasing the patients. So that's it for today on this practice. We think this is something you should pursue. Queens County, New York, great opportunity. Give us a ring. Call Dr. Gary today, 201-663-0935. Hit the subscribe button if you want to hear about more of our videos. I hope you're outside today. It is beautiful as a beach day. I couldn't go today, but I'll be there all summer. I'll be recording from the beach there also. I'm just about ready to go for a bike ride, just trying to get a little work done today. But thank you for tuning in. Hit that subscribe button so you're up on all these. As you know, we are doing, I think we've surpassed 600 videos. I don't think anybody in the country has that many. We enjoy this. We try to bring you cutting edge things that happen. Occasionally we'll be telling you about newer practices, which I think you should pursue. And then other times we'll tell you about the events of the day, what's going on. We've got a landlord giving us a really hard time right now. It is a large corporate entity in a suburban area. And they said to us, well, we'll get back to you in a few weeks. A few weeks? It's 4 weeks already. We'll get back to you in a few weeks. Buyer's nervous, seller's nervous. We're going to put a video out on that. It's difficult sometimes with these landlords. Even though the economy's bad for commercial real estate, some landlords giving us a hard time. Stay tuned for that. I'll try to give you an update on that. Have a great day. Get outside. Enjoy yourself. I certainly will be out there. And we'll catch you on the next video, team. Thank you for watching today.